Premature baby feeding methods. Feeding is given special attention in the intensive care nursery at UCSF Benioff Children's Hospital. Babies born before weeks 32 to 34 of pregnancy usually can't nurse or drink normally from a bottle. Instead, these babies receive nutrients by gavage feedings, in which a tube is placed through their mouth or nose into their stomach. Although many premature babies can't breastfeed because they can't coordinate sucking, swallowing, and breathing, mothers can still pump breast milk. The staff of the intensive care nursery will store it and feed it to your baby by gavage feedings. In almost all infants, feeding difficulties are temporary and resolve as the baby matures and gets closer to the full-term due date. However, some infants may suffer from more severe feeding problems that can lead to other conditions, such as necrotizing enterocolitis, or NEC. As a serious problem of the intestines, NEC affects a very small percentage of extremely premature babies and may require temporary stopping intestinal feedings, treatment with antibiotics and, in severe cases, surgery. There are many different ways that babies are commonly fed in the NICU, and the method chosen usually depends on their gestational age and whether they have any other medical conditions that are hampering feeding. Some of these feeding methods may be combined with another as your baby matures. Breastfeeding, even though they might have trouble early on, many preemies get the hang of nursing while still in the NICU. Bottle feeding, you can pump breast milk or use formula in a bottle for your baby. Sometimes, even if a baby is able to breastfeed, a doctor might recommend feeding your baby breast milk or formula from a bottle so you can see exactly how much milk your baby is taking in. Feeding tube. A feeding tube gives your baby nutrients they can't get from breast or bottle feeding. They might need a gastrostomy tube that feeds directly into your baby's stomach, a nasogastric tube that goes through your baby's nose into their stomach, or an orogastric tube, which is inserted into your baby's mouth into their stomach. Babies on feeding tubes are often given a pacifier to strengthen their mouth muscles and practice their sucking skills. Intravenous line, usually used for the smallest and sickest babies, and four-lined for feeding supplies your baby fluids and nutrients directly into their bloodstream. It's common for parents to feel that NICU staff is trying to overfeed their babies or that they're just not hungry enough to drink all that milk. Try to remember that preemies have higher nutritional needs than full-term babies. Spurts of catch-up growth will help support the development of their brains and their bodies. It's common for parents to feel that NICU staff is trying to overfeed their babies or that they're just not hungry enough to drink all that milk. Try to remember that preemies have higher nutritional needs than full-term babies. Spurts of catch-up growth will help support the development of their brains and their bodies.